Hi everyone, good evening. So I'm Nirmal Fernando. So today we'll talk about accelerating digital health innovation with WSO2. Hopefully that clicker works. Okay. So when I think about this topic, when I work with the healthcare customers in the space, I always was wondering, what if hospitals already get, they are getting patients already, right? So why they bother innovating? So I'm sure some of you are from the healthcare sector, or you may be already providing solutions to the customers in the healthcare sector, right? But then you may also have the same question. So let's, So let's think a bit about this problem, right? Why hospitals need to innovate? So one thing that came to my mind is the rise in patient expectations. So we all are patients, right? We all have to go to hospitals, get some treatment, etc. We all have, today in this current world with the AI dominating and our experiences with different various services are improving, we expect the same from the hospitals as well. So as a patient, I would expect the hospital to give me a seamless experience. Like when I go and get a treatment, I shouldn't be waiting in queues for a long time, right? I should be able to digitally connect with the hospital. I should be able to book my appointments online. And then if the hospital can't keep up with this pace, with these patient expectations, obviously there will be another hospital who understand the patient expectations better, and they would come up with these innovative solutions, and then the hospitals who don't basically stand up to the expectations will have to die. So that's one of the reasons hospitals have to innovate. Operation costs, think about the aspect of having very unoptimal operation processes in the hospital. If we can reduce the administrative burdens, reduce the time that your nurses spend time with the hospitals, and try to automate the documentation analysis, submitting reports from one department to another, etc. You can innovate in that space in this era and make them digital as much as possible, so that you can be cost optimal within your organization. And then shortage of medical staff. This is a global problem. This is not just a problem to one country. Since we are in Sri Lanka right now, it's a huge problem in Sri Lanka, but it's not just limited here, right? But with the innovations, if you can bring those innovations in, you can essentially use the time of your staff optimally. Compliance and data. So most of the governments, most of the regulatory bodies coming up with regulations so that you have to basically comply to several standards, data, otherwise you would lose the license and you can't operate. Emergencies basically expose gaps within the hospitals. COVID-19 was a prime example, right? Most of the hospitals basically couldn't understand how to operate. But then there were some hospitals who had the telemedicine, digital paths opened up. They could innovate, they could get more customers faster, and they could provide better care. Competition and reputation. So obviously hospitals have to keep a good record. So if they can't innovate, if they don't want to innovate, they will basically not be able to stand with the competition. So how hospitals can innovate? Like, there are several things they can do differently. I think some of them are already doing this, some of the leading hospitals. But then, in my experience, I see like there's a huge reluctance to innovate, to change the way they operate, to change the legacy systems that they use, to try this innovative AI technology, etc., within hospitals. So these are some of the areas that they can think and innovate. Digitize patient journeys. So by that, what I mean is they can, if they are not already doing, they can host an online appointment booking platform. They can make the waiting queues virtual, so that people don't have to wait, don't have to come to the hospital and sit there till 20 plus patients before them finish seeing the doctor, right? If they have a virtual queue, they can basically go there when their appointment is closer. And likewise, you can think other avenues to digitize the patient journeys. Modernize the internal workflows. So one prime example is in the US. There's a regulation. Basically, there's this process of prior authorization. Even in Sri Lanka, even in other countries, it's there. Like most of the, basically for your healthcare treatments, insurance companies would pay for you, would basically bear the cost. But then in order for them to bear the cost, you would have to, like hospital and the payer, the insurance company have to basically negotiate and come up with an agreement or get a prior authorization before they proceed with the treatment. So these processes are very manual. In the US, surprisingly, it takes months, sometimes like to get a prior authorization decision. But then you are risking the patient's life, right? Imagine a cancer patient who wanting to get a surgery. If you take 3 months to give the prior authorization decision, the patient may die by that time. So that's why hospitals need to innovate and modernize these internal workflows as well. So they have to think how to use AI. I'll be showcasing few scenarios, few demos, some ways that you can think and apply to your organizations. They have to be interoperable so that they can connect with different healthcare organizations, insurance companies, other hospitals, clinics, laboratories, pharmacies, etc. And also they can expose these patient health record to third-party apps. They have to invest in cybersecurity and privacy, of course, since these are medical data. The privacy of the patient, privacy of the data is of utmost importance. They have to embrace personalized and preventive care. Now, as a hospital, we expect them to know us, know our health record. We shouldn't have to go to them and tell that we came last week and did a lab test. So they have to know us. They have to understand the data. They have to keep maintaining our health record and then give us some personalized care. So there's a quote saying, "Stop accepting what's broken and start building what works." So I think most of the hospitals also have to come to this level of thinking where, they have a lot of legacy systems, legacy data formats, but then they have to stop accepting that things are broken, but then they have to start thinking new, start building facades, layers on top, so that they can hide the complexity but give a better experience to their patients. So let's see some use cases in action. So this is an online appointment booking example. So here, what we have basically done is we are showcasing how a hospital can open up a appointment booking agent. So this is not just the traditional appointment booking where you see now, like we go to or.com or some site and do it, fill the forms, fill a lot of details, and get the bookings done. This is a interactive way. Like today, you have to cater your patients, try to be closer to them. You have to give them natural language interfaces. So here, with our platform, you can build AI agents who understand the natural language and transform them into your health record system. Like in this case, the hospital EHR is exposed through a FHIR API and through a MCP server, so that the LLMs, large language models, can connect to the MCP server and query the data in natural language. So here, as you can see, the patient wants to understand its current appointment and then want to go ahead and reschedule the appointment. So the agent will, or the chat, this is just a IDE that we are showing, but the hospital will have to host the web portals, patient portals. Through the portals, they can provide these chat interfaces. And we can move to the next. Okay, so this is another example where we want to showcase how you can provide a patient support. Like in this case, basically the chat interface understands the electronic health record system. It goes through the EHR and find out the patient's longitudinal health record, and then it can basically answer any question. So this is how you can build agents using the Ballerina integrator. I think yesterday in the lab sessions, if you attended the integration sessions, you noticed these. And then we hosted MCP server for the FHIR APIs in Choreo. So Choreo supports MCP servers, hosting MCP servers. And then if the agent is hosted in Devant, that's our iPaaS integration platform as a service, where you can build agents and host them in iPaaS. And so you can see the Devant platform here, the configurations where we are basically listing the MCP server details so that the LLM can connect to the MCP server. And this is the application. It's a Smart on FHIR app, and it basically connects to the Epic EHR in the backend, and the patient has to log in and authenticate itself to the EHR, give the consent to access the patient data, the data they need to basically see and query, and then come back to the application chat interface so that the application understands the patient demographics. So it basically says now, hello, the patient name. And then you can query and basically ask, has my weight changed significantly recently? Things like that. And then again, another query can be, can you list all the vaccines I had in my lifetime? At that particular hospital. And this is, first two samples are using AI interfaces, but you don't have to go there at the first phase. You can approach an iterative approach, and this is basically about exposing international patient summary through FHIR APIs. So FHIR has a international patient summary implementation, right? Basically, what happens there is, patient's health record can have lots of details, right? It's usually huge. But then in an emergency care situation, you don't need to have access to the full record. What the paramedics want to see is basically instantly what are the allergies, what are the medications the patient is taking. Those instance detail can be accessed through the international patient summary. And with our platform, you can build those digital APIs, avenues, and expose them through your portals and through third-party apps. Okay, those were some use cases, but then we don't have to limit to any of those, right? We can think beyond and innovate in this space. So I want to put some reference architectures for you to think and understand what we offer. As mentioned during the conference, WSO2 is offering a platform, right? You don't have to build the platform. You have to focus on your customers, patients in this case, or if you are into healthcare insurance members, and build the business logic to fit them. So in a typical healthcare organization, you have the systems of record. There can be various systems, and then you want to give patient portals, different AI agents, apps, so that you give better care to patients. We provide you with several development tools very specific to healthcare with our Healthcare Accelerator suite. Basically, you can generate FHIR packages to any implementation guide. So if you are from a country other than the well-known ones, I mean, even in Sri Lanka, there's a LK FHIR profile. So what we can do is basically feed it through our tool, and the tool will generate the code automatically, so that you don't have to, from scratch, you don't have to build them. And then there are other tools as well, and there's Healthcare Copilot, who knows about the healthcare, who knows that you are trying to build a healthcare integration. It understands FHIR, HL7, it understands how to connect to EHRs, and it will help your development teams to become more productive. And as part of our Healthcare Accelerator suite, we provide several pre-built connectors so that you can connect to any FHIR server, any EHR. It understands FHIR, HL7, H12, CCDA documents. We support Smart on FHIR, MTLS, and all that. And there are pre-built transformers from HL7 V2 to FHIR, and from legacy healthcare data to FHIR. Obviously, we understand the domain is complex, and these pre-built transformers might not work all the time. So that's why there's an option in the platform. When we design these accelerators, we design that in keeping them in mind that you would probably have to customize them. So you can add that thin custom layer where you have to do, write a function or two based on the things that you want to change. You can add that custom layer. And then we provide FHIR APIs, pre-built FHIR APIs, audit services, terminology, all that related to FHIR. And then the security, the APIs, of course, you'd probably have to customize based on your requirement. So previous slide is about how you can digitalize a hospital or a healthcare organization and what accelerators we provide. Now this slide, I am going one step further and explain you a reference architecture on how you can leverage the AI, the tools that we've built, the MCPs, Model Context Protocol support for FHIR that we've built, and use them in your use them to build agents, a set of agents. I have listed few sample agents here: appointment scheduling, patient support, population health. As a hospital, you would want to understand, what are the seasonal patterns. You want to anonymize the patient data and do some population analytics. So you can get them done easily through a set of agents. And of course, you can build custom agents as well. Okay, so let's go into a few slides about each and every accelerator. Not each and every accelerator, but I'll do a few things since I have limited time. So we just open source a FHIR MCP server. This is the only only MCP server to expose any FHIR server. So what we've basically done is, you have FHIR APIs. Now the trend is everyone is basically exposing FHIR APIs, even EHRs. Since that's the interoperability message format in healthcare. So what we did was we wrote an MCP server that basically can essentially expose any of those FHIR servers. So you can deploy our MCP server or deploy on cloud and expose your FHIR API through a MCP server so that the LLMs can basically query it as a tool. And this is the only MCP server that supports proper smart on FHIR based authentication and authorization. And this works with all MCP clients. If you like it, you can scan this and get the Git URL, and then if you like it, start it. So future of healthcare messaging is FHIR. So we have to, I think all of us have to understand that and work towards that. So as WSO2, through our healthcare accelerators, we are trying to basically be the language, be the integration provider that provides and touches all the corners in FHIR. So whether it's understanding or defining a patient record. So as you can see on the left side, that's a patient record. It's a pre-built international FHIR international patient record. And using our tool, you can generate your own patient records that are basically complying your regional standards. And we support Smart on FHIR as well, and all the other tools and batteries that you would require to become an interoperable healthcare organization. So these are some of the accelerators. This is from our library, Ballerina libraries. So we provide FHIR R4, R5 support. And there's a set of libraries for all HS7 versions. There's a library for CCDA. There's a set of libraries to the well-known implementation guides out there. But as I said, any implementation guide within a matter of minutes can be turned into a library like this. And then we have a FHIR client. You can invoke any FHIR server, repository. And then there are other tools like validators, international patient summary, terminology service, and data transformation libraries. So you can really speed up the healthcare interoperability and fire it up. I think Mifano also probably showed this, but this is how you can do visual data mapping from your legacy health data to FHIR standard. Since the tool understands FHIR, it already has the structure of the FHIR definition presented to you visually. Now you can drag and drop, use the AI mapping, and build the data mapping logic. And there are many more healthcare accelerators. Obviously, due to time, I can't show them. But you can connect with me. Our team is also here. So we will be available in the O2 oxygen bar as well. So if we put it all together, what we are providing is, underlying is the WSO2 platform, API management, integration, identity and access management. And on top of that, we built several healthcare accelerators. And Sashi and Amjad and other speakers will talk about the other accelerators on financial domain that we have built as well. But here I'm focusing only on healthcare, so that's why the healthcare accelerators is there. But it's the same concept. You have the base WSO2 platform. On top of that, we've added these batteries. It's not a new product. If you are using WSO2 already, you can easily bring these accelerators in. And then build innovative digital health experiences. And of course, you can run it by yourself in private cloud or host it in our iPaaS or in our software as a service offerings. So I'd like to end my talk by putting this statement. Right data at the right time can mean the difference between loss and hope. So what this essentially means is, especially in healthcare, you are dealing with patients, you are dealing with emergency situations, life and death situations. So if you have access to the right data at the right time, instantly, you can essentially serve patients better and at the end of the day, save more and more lives. You can find me on LinkedIn. You can scan the QR code, and thank you. If there are any questions, I can take them. Yeah, so if I go back to the... Yeah, so we have three main layers, right? API management, integration, and identity and access management. Each of them have their cloud offerings. API manager has Bijira, that's API management as a service. Integration has Devant, integration platform as a service. Identity and access management has Asgardio, that's identity as a service. So on top of that, we have written our accelerators in a way you can easily use them even in SaaS, even in our SaaS offerings, as well as in on-prem solutions. No, so we don't want to go there. That's why we are working with our partners. As WSO2, we basically want to build the middleware platforms, right? We don't want to build the end user solutions, but we are helping our partners, our customers, by giving them all these accelerators so that they can build their integrations much faster. That's our basically vision, and we are trying to stick to that. We not offer like a healthcare cloud or something like that. We are not going there. But our partners, we welcome all of you to think beyond the general platforms. I'm sure most of you have healthcare practices, so think what you can do. Especially in the US, there are regulations around prior authorization, peer-to-peer data exchange, patient access. So we have done a lot of work. We have open sourced all our reference implementations using these accelerators. So that you can refer to them, you can talk to us and get some ideas and build those end-user-based, hospital-based systems using our technology. Sorry? Right, in Sri Lanka? In Sri Lanka, I don't think we have any healthcare customers, but we have majority of our healthcare customers are in global reference, but we can talk to you and give you some names. Yeah, so I can basically say one of the largest hospitals in the US. There's a pharmacy benefit manager in the US who's using our solutions. There are payers, there are hospitals as well. And we are talking to several customers, prospects, who is really, so the FHIR is slightly new, right? The people start to think about interoperability. They are starting to think about interoperability right now. So we see a lot of interest, a lot of demos we are doing, a lot of presentations. So there's a huge interest, and I think FHIR is catching up. So we basically want to become the language to build any healthcare applications. Okay, thank you very much.